So the next person that I would like to introduce is Jon Olsen. Many of you will also know Jon Olsen, who is a research fellow and leads the mobility work stream within the Places and Health programme at the MRC CSO Social and Public Health Science Unit. Jon is a health geographer by background, and his research interests are in spatial epidemiology and population health. He's also the associate editor for the environmental health section of the BMC Public Health Journal, and today he's going to be giving his seminar on unhealthy commodity advertising, understanding individual and area-based policy interventions for children's exposures. Thanks, Jon.
Thanks, Shona, and it's great to go after a fantastic talk by Mark, which was really interesting. So firstly, I want to thank Fins for inviting me to present today. I've attended a good number of the seminars over the years, and it's great to be asked to contribute some of my work. A slightly different setting, but it's still great that they're still organising the event and we're able to come together. So as Shona mentioned, I'm going to talk today about unhealthy commodity advertising. My presentation is going to cover 4 key areas. So I want to give a really short overview of the current UK advertising policy for children. And then I want to focus more on a piece of work we led here in Glasgow to obtain detailed data of what is being advertised at bus stops across Scotland, and then really focus on measuring exposure to bus stop advertising. And this is thinking about it in 2 different ways. So firstly, using area-based variables, such as defined boundaries around areas such as homes or schools. Should we be limiting advertising, say in set boundaries like 100 meters to school? Or should we think more broadly about actual children's real exposure using data such as GPS that understands that children may not live and spend their time fixed in these geographical boundaries, and what that means for its exposure. Then finally, I'm just going to touch on what were the findings of this research and how might that implement policy and recommendations. So children's exposure to unhealthy commodity marketing advertising is a global priority for policy action, and that's due to its status as a risk factor for the development of non-communicable diseases. And inequalities in levels of obesity for school children are increasing. I've extracted some data from the National Child Measurement Programme in England, and what this shows is children's obesity levels at year 6 of primary school. So for Scotland, that year 6 is that last year of primary school before they enter secondary school. And what this shows is the percentage of children who were obese from 2006-7 to 2016-17. And I think what's really striking in this graphic is that for children living in the least deprived areas of England, that actually this has remained relatively stable, and in more recent years has actually decreased. Whereas children in the most deprived areas, the obesity levels have actually increased. And what's really striking is those increasing inequalities between children living in the least and most deprived areas of England. And there'll be similar pattern in Scotland. And recent studies in both Scotland, so some research by Nathan Critchlow and Sterling and his team, plus systematic reviews that were undertaken by teams in America, have shown that increased awareness of advertising of unhealthy products is actually associated with increased consumption. And putting all these together, it's really important to understand whether particular socio-demographic groups are more exposed to advertising, which is then contributing to this wider obesity and food system. But governments have taken some steps to try and protect under 16-year-olds from exposure to advertising of HFSS foods, so that's high in saturated fat, salt or sugar products. And the UK Advertising Standards Authority in their CAP guidelines advise media owners to ensure that advertisements are reasonably placed, and specifically that in areas where there's more than 25% of under 16-year-olds spending time there, such as the school, that advertisements should not be placed for unhealthy products within a 100-metre buffer. so no advertisements within a 100-metre buffer of the school. And some advertisers have set their own standards and will not advertise within a 200-metre boundary of school. But actually compliance with this guideline and whether actually those restrictions need to be increased, so whether the restrictions should state that it should be 200 metres or potentially 800 metres has not been assessed. And that was one of the aims of our study, was to understand what's being advertised within 100 metres, 200 metres and 800 metres, and potentially should the guidelines change to protect children's exposure to advertising. So I'm now going to describe and focus on a piece of work we published early this year, and the full text is available, and I think Sheena is going to add this to the chat so you can access this. And the research is over 4 stages. So the first stage of the research was to complete an audit of what is actually being advertised at bus stop locations in Scotland, which we currently do not know. A lot of this data is held by private organisations and they do not freely release this. So we needed to collect this data ourselves. So we completed an audit of bus stops, which sounds very exciting. And we did this audit across the central belt of Scotland, which contains the 2 largest cities in Scotland of Glasgow and Edinburgh. But what it also contains is the urban and rural areas between, so those smaller towns, smaller rural type areas, and it contains roughly around half the Scottish population. So it's a significant geographical area containing a significant amount of people. And if we zoom in a bit closer and add that road network, it starts to resemble something a lot more familiar, and we can recognise Glasgow and Edinburgh. So the next step was actually to extract the bus stop locations across this area. And you can see each orange dot placed on this little map is a bus stop location. And between Glasgow and Edinburgh and that central belt area, which we defined ourselves, you might not recognise it as your definition, there were 10,305 bus stop locations here that we wanted to audit. Before we audited the area, we needed to develop a rating questionnaire. So you can see here from this little sort of flow chart how we developed this. And we developed it in 2 ways. We wanted to know what categories of adverts we needed to include in the audit and capture. And this was based on the literature on the commercial determinants of health. Plus also we spoke to some people from representatives from health charities and public health agencies in Scotland to really capture which advertisements were important for them, for their policy priorities. So using this data from the literature and from the consultation, we were able to create our bus stop rating questionnaire. So this was what we wanted to understand and categorize. So each bus stop that we rated, we wanted to know whether any of these products were being advertised there. So from fast food products, confectionery, sugar sweetened beverages. But what we found was actually this was quite a substantial list, and a lot of these categories in our audit, when we looked at them, had actually quite small numbers. And when we wanted to do our statistical analysis later in the project, we decided we were going to group a lot of these categories together for analysis. So what I'm talking about later in the results are the combination of these individual categories grouped into an overarching unhealthy food and drink that includes unhealthy food products and sugar sweetened beverages. Then we looked at alcohol products, gambling and e-cigarette products. So we had all of our bus stop locations and we had our rating questionnaire, and our next step was to complete an audit. And we actually did this virtually. So we used some software that had been developed by our collaborators in America. And what it allows you to do is virtually audit streets. So it did limit our study because we weren't able to look at, say, train locations and see what was being advertised within buildings, only externally. But the great thing about this data is it can take you virtually to lots of places very quickly using Google Street View data. So we recruited 3 fieldwork researchers who basically sat at a computer that looked like this. And on the right hand of the screen, you were taken to each of those 10,000 locations. And on the left hand of the screen, you're asked whether A, there was a bus stop there, B, whether it had an advertisement there. A lot of bus stops are just a pole without an advertisement, and then how many advertisements were there, and then to rate each of those advertisements using that questionnaire that we've developed. So the results of this data, so there were 10,305 bus stop locations that we audited, and only 1,845 bus stops had an advertisement or more, and we categorised. And that, with bus stops that had multiple advertisements, resulted in a total of 3,123 advertisements. So this is what was being advertised at the bus stops across Scotland. So we can see 56% were other in terms of our rating questionnaire, and shortly I'll just explain to you what those other categories are, so you sort of can understand what else is being advertised there. But in terms of unhealthy food and drink products, the unhealthy commodity advertising, 15% of all bus stop locations contained a fast food product, 7% were confectionery, 4% alcohol, and 4% sugar sweetened beverages. So you can see a lot of the products, 15% were fast food. That was the majority of the category for the unhealthy commodity advertising. Just to touch on what those other categories were, so you can understand what else was being advertised at bus stops. 12% were finance related, such as banks. 11% were phone, broadband, and TV providers, such as Sky, Virgin Media, for example. 10% were TV, film, or cinema, so the specific programs that we advertised, and 9% were travel. So using this vast amount of data that we've collected to understand what the advertising scope was across Scotland and what was being advertised there, we wanted to understand whether unhealthy commodity advertisements were more likely to be in places in more deprived areas. And what this chart here does, it presents the grouped advertisement categories by area socio-economic deprivation. So the chart shows that most advertisements are in more deprived areas, and this is likely to be because those busy roads that contain those bus shelters with advertisements are in more deprived areas. But our key question was whether the placement of advertisements followed this pattern. And we actually found that the placement of advertisement types also followed the placement of the advertisements. So we did not see a disproportionate amount of unhealthy commodity advertising in deprived areas outwith of the pattern of where bus stop advertisements were located. And a similar pattern was shown in our regression models. So the main message really from this is that most advertisements are within more deprived areas, but actually outwith that pattern, the placement of specific adverts follows this pattern also. So then, as I touched on at the very start of the presentation, we really wanted to know whether advertisements were more likely to be in areas surrounding schools. That was one of our key outcomes that we wanted to explore. So as well as our bus stop data, so as you can see here, all those blue dots, which is a bus stop, which we rated, we understood exactly what was being advertised there from our Google Street View audit. We then were able to obtain the school locations across Scotland. So each of these little orange dots here is a school location. So from this, we were able to add these boundaries to the school locations. So firstly, we drew a 100-metre network buffer around the school location and gave each of the bus stop locations a yes/no binary outcome of whether it was close to a school. So you can see here in the centre next to this 100-metre sign, that there's two little blue dots which were within 100 metres of the school. So they'd be categorised as yes, they're within the school buffer. And in our later analysis, we were able to do some modelling to explore what was being advertised there for those advertisements within 100 metre. Then we wanted to explore the 200-metre buffer. So does expanding the 100 metre to 200 metre make a difference? And finally, the 800-metre buffer, which was something that people in the Scottish government were thinking of exploring as a policy option. which you can see is pretty large. So when actually you draw 800-meter buffers in urban areas around all of the schools, it pretty much covers a significantly larger area. So what do our results show? So this looks like a complicated graph, but I'm going to talk you through it. So what this chart does is presents the likelihood of an advertisement more or less likely to be less than 100 meters from school. So the line through the middle is more than 100 meters, and if it's to the left, it's less likely to be 100 meters from the school, and if it's to the right, it's more likely to be within 100 meters of the school location. So what these results show is actually for unhealthy food and drink, unhealthy food and nicotine products, they're actually less likely to be within that 100-meter boundary of the school. Whereas other advertisements and gambling advertisements were shown to be more likely. So what these results show is that they indicate that it's very unlikely that unhealthy products were advertised within the school environment. And actually, I've presented this for 100 meters, but this was consistent from 100 meter to the 800-meter network buffer. So if we increase that buffer to 200 meters or 800 meters, it's actually not going to make much difference to exposure. And just to touch on the gambling, so that's something to keep an eye on, but the numbers were very, very low. So it's something that we may want to explore in the future. So finally, in our research, we wanted to understand children's real exposure to bus stop advertising out with those small boundaries around schools. So far we've used those static boundaries to understand whether bus stop advertisements were close to schools or in more or less deprived areas. But what this doesn't do is account for the fact that children are highly mobile and they're not restricted to individual polygons around their home. So children might have plenty of places to go to visit, they might go to family, friends, clubs, all over the city, which may not be defined within that 100-meter boundary. And therefore our final step was to join that bus stop audit, so those locations coded with the advertisement content, to actual GPS tracks of school children to show where the adverts were that children encountered as they travelled. So we did this using data from the Spaces study, which is something we hold at the MRC Social and Public Health Sciences Unit, and it collected detailed mobility data for children across Scotland. Children were aged 11 and 12 and wore GPS devices over 8 days during waking hours. And in our analysis that I'm going to present the results for, there were 229 children included. So we used the Spaces GPS data to measure the individual level exposure. And as you can see from this little graphic, which tries to sort of simplify what we did, we were able to see children move past it. So this is the GPS track and the little person, and whether they moved past bus stop and therefore were classed as exposure. There's a lot more techie detail, but I'm not going to go into that now. But basically, the longer, more GPS points, the greater exposure they would have, and then to which advertisements were there. So moving on to the results of that exposure analysis, this chart presents the differences in exposure to advertisement categories between the most and least deprived groups. So down the centre, we have the least deprived. If it's to the left, there's less exposure to advertising in the most deprived compared to the least deprived. If we move to the right of the line, children from the most deprived area have greater exposure than those in the least deprived. So what's really important to show here is that children from the most deprived area compared to the least deprived area have greater exposure to bus stop adverts, so the wider transport network, also unhealthy food and unhealthy food and drink product advertising. And although the little dot is to the right for sugar sweetened beverages and alcohol, the confidence lines crossover, so these were not significant. So the main results show that these indicate that children living in the most deprived areas encounter more bus stops, significantly more, and they also experience significantly greater exposure to unhealthy food and drink, and other product advertising. So that's the research that I presented, and just the key findings, the takeaway messages, is that the current ASA restrictions have likely been effective in reducing advertising around schools. So that's something to take away. But children who resided within more deprived area had greater contact with the transport network, and they also were more likely to be exposed to unhealthy food and drink advertising. So based on our findings, we recommend that a transport network-wide restriction of unhealthy commodity advertisement is in place rather than any changes to school-based spatial restrictions. And they're likely to be inefficient because focusing on schools only doesn't capture that real exposure that children are getting to advertisements. And there's examples of similar policies such as in London, Ireland and New York that governments in Scotland and the wider UK and the world could look to implement if they were using this evidence to influence policy. Finally, I'd just like to thank my co-authors and also point to the full text article, which is freely available and I think has been added to the chat, so you can download this. And also, if you'd like to contact me, I'm happy to talk about this some more. And just finally to say thank you for the invitation here today, and I'll pass back.